All right, good afternoon. My name is Frank Quesada, and I'm one of the co-founders of MSP Recovery LifeWallet. With me is Chris Miranda, our Chief Information Officer. Today we're going to address a few points on the data world that we all live in. You know, the healthcare industry, the insurance industry, our individual lives aren't as well connected as everyone thinks. The digital transformation of different industries has been amazing. It's amazing nowadays how we can get up, be in our pajamas, and order anything on our phones from around the world and have it shipped to us. But at the same time, you have to send a fax to your insurer when it comes to dealing with certain issues with your insurance company. So it's disjointed. The development of the digital transformation, yes, it's moving us forward. It has been incredibly impressive in certain industries, but not in all industries. For the most part, industries are not on the same pace. Some industries are taking their time to get up to speed. Others are moving incredibly quickly at lightning speed. What ends up happening is each one of us suffers in that kind of situation. When you don't have industries that can speak to one another, we're all at a loss. The average individual has about 191 passwords for the different websites and the data sets that they visit. With 190 different data sets that we all have a little piece of, it's incredibly difficult to track everything you have and connect your worlds. MSP Recovery LifeWallet, we are the biggest data company that you've never heard of. We're in all 50 states. We see the complete medical history for roughly 34 million Americans every day. We created this business really focused on healthcare and insurance, trying to understand those worlds. When we began this business back in 2014, we never thought that there were so many industries that weren't speaking to each other when it came to data. My partner and I, when we first created this, we're trial attorneys. The good thing about being a trial attorney is we're very good at finding experts. We're very good about questioning things. The bad thing is my 8-year-old daughter is probably a better coder than I am. And every time I have to turn on the computer, I got to ask someone on the technical team to help me get that started. But the best thing about trial attorneys creating a data company is we question absolutely everything. You, for your governments, your municipalities, where you work, you should be questioning all the different data sets that you see. You should be ensuring that your citizens and you have access to all those data sets, to have that intelligence to make sure that you are providing that complete service that you want. Having the security in place is always an issue. All the cities, all the governments that we deal with always have that issue. It's always the first question. You want to make sure you have that. Our company and what we've been able to do and what we've learned is when you bring different industries together, it is critically important to ensure that you're thinking about different industries and you're not just solely focused on one. A CIO of a municipality, a data team that works for a state or the federal government should not just be thinking about the governmental services, but everything that the residents, the constituents, the customers, the consumers are dealing with on a daily basis. When you build a company looking at different industries, we have former prosecutors, we have analysts, we have investigators, we have a medical team. In our DNA, in our makeup, is really to identify problems, to identify flaws, and to incorporate the top technologies of our time to make it easier for governments, municipalities, and states. What you see on the screen here is just a sampling of a few different data sets. We're probably looking at 50 different passwords to access the data sets that you have up there. Now, just because I may use the same password 50 different times, that doesn't mean there are 50 different access points. It's about ensuring connecting the different data sets for every individual and using it for the government's advantage. We've built algorithms in order to connect these industries. We've built data sets in order to ensure that we are capturing all the necessary actionable intelligence for a government or a client, a payer, or a provider to make the most well-informed decision. And we've partnered with some of the top companies in different industries to make that happen. But again, if the data is not accessible or understandable, it isn't helpful. One of the first things we realized right out of the gate is when you're analyzing healthcare data, when you're looking at insurance data, when you're looking at the information that an everyday citizen is accessing, there are a lot of disconnections. It is incredibly fragmented. Believe it or not, one of the worst ones that we saw right out of the gate is law enforcement, paramedics, and healthcare. To talk to you a little bit more about that, I'm going to turn it over to Chris, our CIO.
As Frank said, a lot of the company has been focused on achieving efficiencies for payers and providers, hospitals in the healthcare system. And we have reviewed terabytes, petabytes of claims data, ICD-9 and 10 codes. We've looked at data from Medicare Advantage organizations, ACOs, MCOs, all the data you can imagine. And one person has always been missing from that conversation, and that has been the patients. LifeWallet is an application that we've developed that brings to the forefront all of our algorithms, over 700 different funnels, 1,200 different algorithms, brings it into the hand of a patient so that they can access their medical records, their information in a cohesive fashion. It also allows them to share that information seamlessly. The sharing of information obviously is very sensitive. We make sure that we are protecting and providing the proper consents that are required. We utilize blockchain technology as well as biometrics to make sure that you're giving access to your data only to the people who you want it to have for that purpose. With LifeWallet, you can enter in information that is critical for your care, the medications that you're using, the allergies that you have, the medical conditions that you have, so that at any moment you can share that with a first responder, with any entity that you're going to come into contact with. This is one of the biggest things that we hear from providers, is that they cannot get access to the records. If providers cannot get access, patients cannot get access either. Something else that we've done is we've created a universal intake form that auto-populates. The statistic is something like 40 minutes are spent at any given instance, at any given doctor's appointment, filling out and ingesting an intake form. So we're working through all of that. We also are going into actually looking at the claims that you have to provide you with FDA alerts that are pertinent to you. If you're using a CPAP machine and there is a recall on that machine, we're able to pinpoint that, isolate that, and provide you that information. These are things that get lost. Attorneys are very savvy with these things, but patients are not. So LifeWallet brings that all into the hands of the particular individual. We also integrate with everything that's available. Like Frank said, there's a huge disparity in the innovations as far as technology is concerned. Some things are very advanced. Your phone, your Apple Watch might have your vitals and statistics, but that information is not, you cannot elect to share with who you want. So LifeWallet allows you to do that.
All right, so that's the general background. Let's get more specific. For the governmental entities that are in the room, critically important for you to understand this. Let's walk through a sample use case. We're going to beat up Chris here a little bit in this example as we're walking through. So if you are a municipality, if you are a state, let's walk through an example. Chris has an issue. He falls, 911 is called, it's dispatched to his location. He has LifeWallet. When I pick up the phone to call 911, routes through the municipality, it goes to the fire department, it goes to the police department. The information now is going to be transmitted that Chris Miranda, a LifeWallet user, and his medical data is now, we know exactly who we are responding to. So that 911 first responder is going to plug into the system that's sitting live in the software for every first responder. And we are currently tied in to a number of different municipalities throughout the country. And what ends up happening is now the first responder, before they get to Chris, before they get to treat him for his heart attack, they know that he's allergic to XYZ medication. They know that he had a stroke 6 months ago. So now in that golden hour, that golden minute, those very precious seconds leading up to treatment of Chris in that situation, now they know. Now that paramedic, that firefighter, that police officer has real, actionable intelligence related to Chris. So this is a real-world solution that will save lives. If the paramedic that's responding maybe hasn't seen or isn't as familiar with the medication that Chris is taking, that could impact the way they treat Chris live on the scene or prior to getting there. They can click on it, they can see the FDA indications, they can see even so much more, so they make a well-informed decision to help them save lives. If he is tied in his Apple Watch or his Fitbit or other fitness tracker, they're gonna see his blood pressure, they're gonna see his heart rate, they're gonna see all the indications that are happening that led up to that moment. Again, the more information that we can give to our first responders in these types of situations are gonna help save lives, help them make more informed decisions. Many municipalities and state governments require certain forms to be filled out prior to administering care, after administering care. All the information that's in Chris's medical records, in this example, are automatically populated into this form. So these kinds of steps of industry speaking to each other is not something that you've really seen before out there. You know, one of the next things that we looked at, unfortunately, industries that were not communicating effectively, especially with governments, was unfortunately related to the opioid epidemic. In the opioid epidemic, really what happened is you had some health plans understanding what was happening, you had some healthcare providers understanding what was happening, you had some law enforcement offices understanding what was happening, and some municipalities. They were not communicating effectively. Because all that data was not being shared and effectively put together and consolidated, there was an issue. It was difficult to find. So by bringing that all together, it allows the industry to move forward, it allows more actionable intelligence to improve communities. Turn it back over to Chris.
To that end, we're able to use the MSP data set, billions of claim lines, 34 million members, to provide a view into the opioid epidemic in the communities that are most hurt. We're able to integrate ARCOS data, census data. We're able to take state-level opioid abatement information and plug it in. We're able to work with some of the leading partners in mental health and drug addiction work there with Spring Health. We're able to connect to the emergency medical services that Frank was mentioning, and we're able to provide analytics at a real-time level to show which states are spending the most for opioids and have the most opioid overdoses, withdrawals, and dependency.
And for local governments and for state governments, this is incredibly powerful. You could be a municipality that was hit hard by opioids, and there may be a city very similar to yours, 1,000 or 2,000 miles away, that may have a better experience and they're improving their community better. This is going to allow you to understand, to see what they're doing specifically, how they're doing it, so that you can reach out and communicate and effectively increase and improve that experience to improve your community.
We're able to standardize that nationwide and look down into the county level to show the trends, the death rates, the associations of overdose, withdrawal, and abuse with opioids. And we're also able to do that historically, so we're able to see the trend and flow over time using our data set and the connections that we're developing with a lot of these other sources. That's an incredibly powerful tool because it lets us show how different efforts to stop the opioid epidemic are working or are not working.
Something that's critically important, there are many municipalities that have been receiving money from settlements that have occurred related to the opioid epidemic. There's required to be evidence-based tracking. There's required for detailed tracking of the spending of that money, whether it's to education, whether it's to abatement, whether it's to treatment or rehab. It's about bringing all those worlds together. We have been working closely with a number of different organizations, both private and public. And with that, we are going to, unfortunately, Dr. Rahul Gupta, the FDA drug czar, wanted to be here today. He was unable to make it. So he asked that we play a message that he made for this event. Dr. Gupta has been working with the White House and with the FDA to present and track the opioid experience and the improvement of that throughout the country, which is something that there is a great need for. It's been such an unfortunate situation, and it's a big part of what he's trying to do, and we're trying to work with him in order to make sure that all municipalities and all states can ensure that communities are helped, improved, and so that this never happens again. So we're going to play that, and then we're going to open it up to questions.
Hello. Thank you to my good friend Mayor Soares for inviting me to be here. And thank you to Frank Quesada for leading this session. I'd also like to say hello to my colleagues from the White House and across the Biden-Harris administration who are taking part. You know, I wish I could be there in person, but I'm grateful to have a chance to connect with so many leaders across the nation. The Office of National Drug Control Policy, which I lead, advises the president on drug policy and develops the president's strategy. We also oversee the drug-related programs and $40 billion budget of the 18 federal agencies that work in this space, spanning both public health and national security. While addiction and overdose affect just about every city in America, the lion's share of dealing with overdoses and deaths falls to you. And I know this firsthand because I've been in your seat before. In addition to being a physician who treats patients with substance use disorder, for 6 years, I was a local health commissioner for Kanawha County, West Virginia, the home of Charleston, the state capital. Now, I served on the board of Ambulance Authority and later oversaw all of the EMS services in West Virginia. So I know how hard it can be to manage the volume of overdoses and to ensure that there are services to help people with addiction. Now, working hard to prevent overdoses and working to help people after leaves your budgets stretched thin. You experience that every single day. And every single time a 911 call comes in for an overdose. And for people who experience non-fatal overdoses, there often isn't enough money to get them started on treatment. We also don't have good systems for tracking non-fatal overdoses, which would help us save so many more lives. And of course, the drug trafficking that enables all this remains an issue facing all of us. So where has this led? Well, to more than 109,000 overdoses deaths in a 12-month period. And more than 1 million overdose deaths in the past 2 decades. Imagine if 109,000 Miamians just disappeared, or half the population of Des Moines, Iowa, or Yonkers, New York, or Huntsville, Alabama. In reality, the progress is much slower and steadier. Now, what we're seeing today translates to an American life lost every 5 minutes around the clock. Why is this happening? Well, because we're in the most dynamic drug supply environment in our nation's history. We're seeing increased overdoses from synthetic opioids like fentanyl, meth, and cocaine. With a rise in use of synthetic substances, Pandora's box has been opened. And these substances ultimately infiltrate our most vulnerable communities. So we're living in historic times. And President Biden and this administration are taking unprecedented actions to meet this moment. The president made this an important issue and a key part of his unity agenda for the nation. And you know, the mandate from him is very clear. Reduce the number of drug overdose deaths, put quality public health services within the reach for people with substance use disorder, and stop the drug trafficking organizations that seek profits by harming Americans. And that is exactly why his inaugural National Drug Control Strategy, which we sent to Congress in April, looks at 2 main drivers of this epidemic: untreated addiction and the drug trafficking profits that are fueling it. The strategy prioritizes 4 near-term actions that we've got to take to meet people where they are and reduce overdoses right this moment. So I'm going to talk about those a little bit. First, the most important action we can take to save lives right now is to have naloxone, or what some people call Narcan, the opioid overdose reversal medication, in the hands of everyone who needs it, without fear or judgment. especially today when 3 out of 4 overdose deaths involve opioids. Now, second, we're going to double treatment admissions for populations most at risk of overdose death and ensure universal access to medications for opioid use disorder by 2025. Third, the strategy ramps up our work on data and research at a time when the federal government faces large gaps in data collection and analysis related to drug policy. For example, we know that one of the best predictors of a fatal overdose is a prior non-fatal overdose. But we don't have this data for every state or every city. Science should drive policy as much as possible. And the sooner we can get comprehensive real-time data, the sooner you all can, we can use it to drive sound policy decisions. And fourth, the strategy is unveiling a renewed focus on disrupting transnational criminal organizations and their illicit finance networks and supply chains, focusing on where it hurts them the most, their wallets. Now, we're going to continue to work with other nations to make it more costly for drug trafficking organizations in every way possible. The president's strategy also directs federal agencies to take actions to prevent youth substance use, support people in recovery, and advance racial equity in our drug policy related to both demand and supply. The strategy expands the scope of this work to address many factors that affect substance use disorder, like child poverty, employment, health, and economic opportunity, so people can reach their full potential. You know, today we recognize that addiction is a disease and should be treated just like one, just like heart disease or diabetes or hypertension. And now we're putting resources behind this new approach. Let me give you a few examples. The American Rescue Plan dedicated more than $5 billion to addressing substance use disorder, money that has already gone to our states. It also sent $350 billion to state and local budgets, with $130 billion passing by state houses and going straight to local governments. Now, this funding is helping cities reduce violence, address homelessness, and affordable housing. It's helping expand high-speed internet, and yes, expand access to life-saving treatment for substance use disorder and addiction. At ONDCP, our 2 biggest grant programs devote more than $350 million to preventing youth substance use and stop drug trafficking. You know, the Drug-Free Community Support Program, it funds nearly 650 community coalitions touching every state. And our High-Intensity Drug Trafficking Areas Program, what we call HIDA, enables coordination between federal, state, tribal, and local law enforcement, working to stop traffickers profiting off of death and destruction. Now, in March, just this year, President Biden announced he's requesting an unprecedented $42.5 billion for drug control budget. This is a $3.2 billion increase. And guess what? 75 cents of every dollar in this increase is targeted to investing in prevention, treatment, and recovery support services. You know, the overdose epidemic is a shared problem, and we all have a role to play in addressing it. To this end, ONDCP has released several state model drug laws that can be adapted to save lives right now. I'll talk about just one that could make a big difference for your cities. Our model law for opioid settlement funds would help state legislatures, communities, municipalities, jurisdictions ensure that the settlement funds from various opioid lawsuits actually go towards helping people affected by this epidemic, unlike the tobacco settlements of the past. Now, you can find this on the ONDCP website. I would love to work with you all about this. Now, these actions I just laid out, this is exactly how the Biden-Harris administration will bend the curve on overdoses, deaths in the United States. But folks, we can't do it without you. You know that. Now, as a physician and as a former local and state health official, now as a federal official, this boils down to one simple question for me. As leaders in our communities and across our country, what legacy do we want to leave behind? Do we want the next generation to look back and see how stigma or gridlock stopped us from taking necessary steps to save lives? Or do we want to be remembered as leaders who ushered in a new era of compassionate, data-driven, high-impact action? Because the bottom line is this: if it's easier to get illicit drugs in America than it is to get treatment, this crisis will never end. So this is our moment to act. Thank you for your leadership. Thank you for the work that you do and lead every single day. I look forward to seeing you in person, and please let me know if I could be of any help to your city and your residents. So thank you.
Some powerful words by Dr. Gupta from the FDA. So if you are a CIO, if you are in the data department, if you're thinking about actionable intelligence for your city, for your county, for your state, for your company, you need to ask yourself, are you gathering all the right data sources? Are you making the best use of the data that you are receiving? You need to take a hard look. Every municipality, every state will get information related to a car crash, related to a 911 call, related to a drug overdose, or anything that's happening in emergency services department. But that data is being analyzed 30 days later, 60 days later. The real way to impact your organization, your constituency, is to have that data live, to use that actionable intelligence in order to make well-informed decisions for your first responders, for your accounting departments, for everyone in that line in every aspect of your business. So I challenge you to dive into your organization, what data sets you're receiving, and how you're connecting and using those data sets in a more efficient way. Again, I'm Frank Quesada, one of the co-founders of MSP and LifeWallet, and this is Chris Miranda, the CIO. Thank you for your time.